you're at a desk doing a lot of typing and things like that, there are exercises for your forearms to get them strong as
Mm,
well as flexible muscles so that we can reduce the likelihood of those cumulative trauma problems over time that we get
yeah.
from just doing the same thing day in, day out, where the demand may be a little bit higher than what our body can actually do.
Pain isn't just about one joint, one injury, or one bad day. It's your body asking for attention, and the right guidance can change everything.
Welcome back to the Optimal Health Guide. I'm your host, Michael. I'm here with Josh Vance, the Optimal Health Guide himself. Josh, how are things going today?
They're going great. Thanks.
Nice. Well, today we're going to be talking about something that I've been anticipating for quite a while. I know it's got to affect a lot of people every single day, even people who don't think of themselves as having a physically demanding job. A lot of us spend a lot of time sitting at a desk. I do that. There are certain days of the week where I've got a lot of hours logged in front of a computer at a desk. And you've talked quite a bit of times about the need that people have to, be aware of their body, what's going on when you're in that same position for a long time. You even had said at one point, most people warm up for exercise, but they never warm up for work, especially desk work. So I'm curious to hear more about that. So we're going to unpack that today and hopefully help a lot of people think about their desk work. Before we get into that content, as we continue on in season number 3, we'd love to hear from you. What health questions, what frustrations or topics would you like to have us discuss on this podcast? You can submit those questions at podcast.vancept.com. Your questions could really help us to shape the future episodes that we talk about. Also, I want to encourage you, if you're finding these conversations helpful, please make sure to like, to follow, to subscribe wherever you listen to the podcast. And if you know someone who spends most of the day behind a desk, share this specific episode with them. So here we go, Josh. What actually happens to the body during long hours at work?
Well, there's a lot of things that happen. When we're sitting in a position for a long time, first of all, our blood's not flowing very much. Okay. So we can certainly have reduced circulation in our body. And with that, blood can pool in our legs. Okay.
Mm,
People with circulatory issues, that can be a problem. People actually, there's such a thing as venous stasis ulcers. In other words, we get wounds in our legs because the blood isn't circulating back and it's
wow.
pooling in there too much. Now, that would be somebody that's got some other probably health issues, but
Yeah.
we do get decreased circulation in our body. Okay. So maintaining movement is certainly an important thing. All those calf muscles, every time we're walking, that calf's like a little pump and go squishes all that blood back towards our heart. So
That's interesting.
that circulation is an important component.
Yeah. Okay.
I think another thing that's going to happen is, we're sitting with our hips bent in a forward flex position all the time, and we're tending to be over the desk. So
Hmm.
we're going to end up with tightness in the chest. We're going to end up with tightness in the front of the hips. And so that's going to affect the muscle length and flexibility of things. Also, in regards to that, we sit so much, we don't use our butt muscles and our back muscles as much
Mm,
and some of our scapular muscles. So, one side gets tight, the other side gets weak. So that's something that can happen. Neck strain, if we're having to look forward at the computer all the time, or we have bad vision, or
hmm.
a lot of different things. But that same idea also, we get a forward head, and I've seen it. And people have a really hard time actually getting upright because they've been at that desk for so long, for so many years. It just is going to affect our joints as we get a little bit tight as well. So that forward head position and even kind of a strain to some of these muscles up here, if we're doing, a lot of computer work, mousing and typing. And of course, that brings on the whole carpal tunnel issue. If we're having to do lots of typing and all that sort of stuff, we are definitely more likely to get a possibility of some nerve involvement in our wrist there. That can cause some issues for sure. And then
Mm,
in general, we're going to just have less movement of our spine and our legs at all in
hmm.
general. And so, just kind of weakness. We sit, we get weak. We got to be standing, moving, doing
Yeah.
things actively. So, gosh, there's a lot of things that happen when we're sitting
Yeah.
for a long period of time.
Yeah. You've, alluded to or said directly that, Like it's like we're designed to move. And so the absence of movement might have some of these issues. So is it sitting itself that's the problem, or is there something deeper going on? Is it that idea that we're actually meant to be moving?
I think it may be a little bit of both. You know,
Mm,
any posture position for a prolonged period of time is not
okay.
going to be.
Yeah.
But yet, when we do sit, we just are stuck there for such a long time that, we get all those things. Now standing, I think is probably better, but, standing also is gonna have some downsides
Yeah.
too. Again, we can have that if we're just standing all day, like maybe I'm behind a cash register or whatever.
Yeah.
Again, we can have pooling in our legs because we aren't getting a lot of calf movement. We are standing, so we're a little bit more active, but we're still it's not an ideal
Yeah.
situation necessarily.
Yeah. So getting into the second question, why do desk workers commonly develop neck, shoulder, and back pain?
Okay. Frequently, it is contributory. There's a lot of different things. You're stuck in a position for maybe frequent periods of time. Even people that do have the ability to kind of get up and move around, oftentimes they don't because they get
Yeah.
engrossed in what they're doing. And I guess from a productive period point of view, that might not
I
be
wrestle
bad.
with that one. Yeah.
Yeah. However, from a productivity, it can also be bad because my neck hurts and they get
Hmm.
discouraged and sidetracked because of pain because they're stuck there. So these static positions where we're always head forward, rounded shoulders, kind of hunched over the desk. My dad used to call them desk jockeys. Okay. So, that position, it's going to cause weakness on the back. We're going to get tight in the front. And oftentimes we also that over time is going to affect the joints. We get stiff in the joint, just like we get tight in the muscles. And that can make it difficult to get out of that position, even if we're trying to. So, just not having enough ability to change positions for a prolonged period of time certainly is going to potentially lead us to developing those sorts of positions. Also, the rounded shoulder thing,
Hmm.
we're going to get tight in the front of the chest, just like we get weak in the back. Our butt muscles get weak. The hip flexors get tight. Again, it's just
Really?
contributory.
Everything.
Everything
Yeah.
is working together for the negative, setting us up because partly we aren't maybe getting out of those positions and doing enough throughout the day
Yeah.
or even on our own time.
Yeah. In a way, you've already alluded to this, but maybe push further. Are there specific patterns that you see repeatedly in patients, especially that work at a desk for so long?
Yeah, they have weakness in their butt muscles. They're tight in the front of their hip. Usually their heads are a little bit forward, kind of tight in the shoulders. They're weak in the upper kind of scapular muscles. Sometimes they're stiff. They usually have a lot of suboccipital or frequent headaches and
Yes.
tightness up at the base of the skull. All
Yeah.
those things because of the shortening of the muscles and the joint segments. They're just not in good position.
Yeah. Yeah. I can see certain days where I work longer, or like you were even talking earlier, where I'm wanting to just push through. I'm close to the finish line on a project. And yeah, I can see where maybe it's not stopping actually could be causing, longer delay than what I'm actually thinking will. So why is it that people feel so stiff after work if they're just sitting there?
Hmm. Good question. Well, our bodies are made to move, and when we don't have movement, that's going to affect our blood supply. That's going to affect the joints. That's going to affect our muscles. That's going to affect did I say joints already? If not, the joints. Our bodies, like for instance, our knees, we have this fluid in our knee joints called synovial fluid that is made. That's like our natural WD-40. As
Hmm.
we develop arthritis over time, which is going to happen if you live long enough, that then tends to get a little bit stiff. So if we aren't moving the joints, if we're in one position, body doesn't like that.
Yeah.
We need to move. So sometimes that stiffness can be due to lack of movement. Okay. Obviously, then if we have joints that are restricted because they're tight in the joint capsule or the muscles are tight or we're kind of not putting ourselves like maybe our shoulders in a good position because we're really intense and we're typing and we're thinking about it or we're kind of
Hmm.
stressed at whatever point
Yeah.
those muscles are going to get tight. They're going to then get kind of sometimes painful, but they can also restrict movement in the joints. So then that can give us a sense of tightness in the muscles, and you get those little trigger points in there, and sometimes headaches too. Again, the muscles are getting tight. So we can feel stiff kind of in the muscles, we can feel stiff in the joints,
Hmm.
the tension from the stress, and we just aren't, we may be there too long again. So we don't
Yeah.
have that normal movement, which is allowing for normal elasticity of the muscles and the joints and everything moving throughout the day like we ideally would be doing.
Yeah. Is there a relationship between stiffness and pain? Are they connected in any way?
They can be, certainly not always. For instance, a person could have stiffness because of muscle tightness, and so they have a little restriction, maybe their hamstrings, and so they have a little stiffness getting their knee straightened out all the way, but yet it doesn't hurt. That's not a good issue though, because they do need that flexibility. But oftentimes, yes, there is. We have
Hmm.
that muscle tension and we feel stiff and tight in our muscles, and that can definitely cause trigger points, myofascial
Yeah.
pain, pain in the muscles, essentially. And
Yeah.
then, of course, if we're driving for 3 hours and that stiffness in that knee joint, and you get up and you try to move it, and it's stiff and painful until we start
Yeah.
moving it around again. So sometimes there is a relationship, but not always.
Okay. That's really helpful. I know we quoted you earlier with what you've mentioned in the past in an episode. You said people warm up for exercise, but not for work. Dig deeper into that. What do you mean by that?
Okay, so we all know, we learned in, middle school, high school, whatever,
Yeah.
you know, you're going to exercise, you need to warm up. So you need to do a stretches. So maybe we stretch for 5 minutes, which really probably isn't adequate, by the way. However, we know in our heads, I'm going to go exercise. I should probably stretch. So I reduce the injury risk and I get those muscles ready to go. And so in an ideal world, we do that. And then we go and exercise. We have a great time and everything's good. Well, okay, so most of us exercise for maybe 30 minutes, 60 minutes. There are some that may go longer, but in that realm, okay. But they're preparing for that. All right. Most people work about 8 hours a day,
Uh,
usually
Wow.
four at a time, maybe five at a time, depending on what. And
Yeah.
some are 12. If you're looking at nurses or some, it depends on what you're doing. But that's a lot longer than you're exercising. And so we need to get ready for the demands that your job may take it. If you're at a desk doing a lot of typing and things like that, there are exercises for your forearms to get them strong as well as flexible muscles so that we can reduce the likelihood of those cumulative trauma problems over time that we get
Yeah.
from just doing the same thing day in, day out, where the demand may be a little bit higher than what our body can actually do. So we prepare for that. We do some exercise
Yeah.
to really get ready for the job that we're going to be doing for the next 4 to 8 hours during the day.
That's a great comparison. I mean, I was following along with you, from the junior high or high school warm up idea. And, people typically work out for 30 to 60. I didn't make the connection that you were leading us to that. Yeah, we're going to work for a long period of time or long stints of time, even. Why would we not prepare like that? Do you have maybe a go-to idea? What would a work warm up look like? You mentioned to
Well,
some degree some things with the wrists and forearms, but what would it look like?
yeah, okay. So in that capacity, for someone that does a lot of typing, maybe it's some shoulder stretches to start with. Just, a minute stretching. Usually I'll have people stretch for 1 minute, one time, and then ideally we're stretched throughout the day. So maybe we start with a little shoulder stretch for a minute, then we start with a little tricep stretch for a minute, and then we're doing some forearm stretches, both for the muscles that lift and the fingers and the wrists up, as well as the muscles that are contracting the fingers and the wrist and bending them down. And then, so that would hit some stretches for that, maybe even a few repetitions of some strengthening exercises to get the forearm muscles nice and strong so they have that ability to work for that prolonged period of time. Maybe even doing some heel raises to get the blood flowing in our ankles and calf to
Yeah.
before we're sitting down for a period of time. So just, doing things that are going to get us ready for that job. Every job's going to be a little bit different.
Yeah.
If you're a tile layer, maybe you need to be doing some squats, maybe some bridges, some butt work also, and stretching some glutes and your back, maybe some hamstring stretches. So it really depends on what
Yeah.
your job is, but those things that are going to kind of affect those muscles and areas that you're going to be in using.
Yeah. That's great. Okay. Well, let's get past the warm up then. What about, are there simple habits that a desk worker could adopt immediately to incorporate into their schedule?
Yeah, I think one simple thing would be taking, I mean, it doesn't have to be a long break, but periodic breaks frequently just to get the mind off of it, looking at some nature, maybe some trees or whatever.
Yeah.
It could be even just a couple minutes, standing up, doing 10, 15 heel raises,
Yeah.
stretching backwards, doing a wall stretch to stretch the chest out, maybe a
Mm,
forearm stretch here and there. And you can vary these throughout the day. So you're doing a little stretching here, you're doing a different muscle here, we're doing some heel raises here, maybe we're doing 10 little squats. We're doing things throughout the day. We're taking a break away from that
yeah.
position for a minute or two, every 30 minutes, every hour.
Hmm.
Partly it's going to depend on your employer, maybe. But if you're just at home, man, you have complete control. Go
Yeah.
take a 10-minute walk, stand up, do some squats, do some heel raises. Make sure your position that you're working is set up ideal. So the monitor is right in front of you. You're not having to reach out for the keyboard. You're not having to reach out for the mouse. So we're not bent over on anything,
Yeah.
and we're just able to put our body in the best position for that period of time. And then regularly, I've even told people, set a timer, put a timer on so
That's
that you're
helpful. Yeah.
aware. Because if you're engrossed in something, time will fly, and you don't
Yep.
even know how long you've been there, maybe. So setting a little timer, just periodically take a minute, take a couple minutes.
If you were to isolate one of those, is there a habit that's like the biggest bang for the buck?
Ooh, I would probably just say getting out of that position that you're stuck in. So if you're constantly sitting, just standing up, getting up out of that position.
Yeah. That's great. All right. Why is it that, quote, weekend warriors get hurt so often?
Well, some of that is due to age. As we age, there's tissue changes that happen. We don't bounce as well, if you will, as when we were,
That's true.
in
Yeah.
middle school. We fall, we bounce, we get up.
Yeah.
When we're 80, we fall, we don't bounce. So, some of it is due to tissue changes that happen over time. But, the weekend warriors, they get hurt often because a couple things. They don't have necessarily the flexibility. Their bodies aren't used to or
Yeah.
ready for the demands that they're going to place on it. So, one thing that comes to mind with it are the guys that go out and play maybe football over Thanksgiving or whatever, and they tear their hamstring, or not their hamstring, but their Achilles tendon. Pluck.
Yeah.
Then they fall down like they just drop down.
Yeah.
All right. So looking at that, they didn't do anything to warm up.
Yeah.
Okay. Very frequently, they have a sudden burst of activity in their calf muscle, and structurally, they're not used to that. So it's a sudden change. The body can't handle it. Maybe they're active, but maybe they're not active all week long, and
Yeah.
they have more of a sedentary job, or they have less flexibility and strength. Frequently, weekend warriors may, if you're not doing something all the time and you go do a sudden change, you're really looking at the great possibility of getting injury, because, you just don't have as much conditioning cardiovascularly, muscularly. You don't have the flexibility, you don't have the strength, you don't have the mobility that you might have. You have a sudden increase in activity, particularly if you don't then warm up, your body's not
Yeah.
ready for it. And even if you do warm up a little bit, you still may not be ready for it, and then you get tissue injury.
Yeah. Oh my goodness. And I'm just thinking too, just how much ego and pride get in the way as well. You're with a group of people. Oh, I don't need to do that. And you're just setting yourself up for trouble right there. We've talked a lot over our episodes about the importance of posture. Is posture really the villain that people think it is when it comes to issues like this?
Well, I'm not sure people even think that how much posture does affect us. I mean, most of us can hear our moms in the back of our head, sit up straight, stand up tall, Johnny,
Yeah.
but yet we don't really give it a whole lot of thought until we look in the mirror and we see, oh my gosh, what is going
Yeah.
on? Why is my head forward? Why do I have this hump here? Why
Mm,
can't I stand straight? Or my goodness, who is that person in the mirror? I don't recognize them. They look old,
yeah.
whatever it may be. So I think most people don't recognize how much of a villain it can be in a sense. But I think, yeah, it certainly is a
Yeah.
gradual, usually it's a gradual thing. Poor posture over time isn't a sudden thing. It usually, well, it can happen just because we're lazy. Okay.
Mm,
Think about a student in the desk. They're in math class, they're just kind of slouching. They're just
yeah.
doing that. We don't think about it, especially, at 15 years old or whatever.
Yeah.
But, it just kind of begins setting up a habit for how we're sitting. Okay. And so, if we're not thinking about that over time, that certainly, moving from high school into college, and then maybe in the adult workplace, depending on what your job is, we aren't necessarily doing things to stretch. We aren't necessarily doing things to strengthen. Maybe we are, which is great,
Yeah.
but it's just this gradual villainous thing, if you want to call it,
Yeah.
that kind of gets us in the long term. Our bodies accommodate to the positions we put them in. So if we're always in a bad postural position, we're going to adapt to that. On the other hand, if we're putting body into good positions and we're exercising it, be it weight training or cardiovascular or stretching, it adapts to that. It gets stronger. It
Yeah. You're
gets
right.
better cardiovascular endurance. It gets better flexibility, joints
Hmm.
move better. So, the stresses that we do or we don't put on things is
Yeah.
going to affect it over time in one way or another.
Hmm. That's a good word right there. Just to kind of close the loop then, what are the long-term consequences if someone ignores these type of issues and they're consistently working in this desk job?
Yeah, long term, I would say probably weakness. We're going to get weak. We're going to have stiff joints potentially, posture, things that we'll have a harder time getting out of, and certainly pain. Long term, we very likely are going to have pain, and it might be from overuse of the wrist, where we're getting nerve injury from carpal tunnel. It may be from that desk position where we're got myofascial pain because of the stress that we're putting ourselves in with bad positionings, not stretching, not changing positions. It may be that headaches and that forward head thing where we just feel like we're always old and can't get up all the time. It may be that we get back pain because, our back's weak and then we just do something simple, putting on our shoes and it hurts. So pain is certainly a likely outcome. Obviously, lack of flexibility, lack of mobility, okay, not
Hmm.
being able to move as well. The other thing is, when we're sitting for so much, we're not using our quads and our glutes. Those
Yeah.
muscles get us moving. That helps us go up and down stairs. That gets us moving forward, standing up. So sometimes even harder to stand up. I've seen people that they got on the ground and they could not get up
Yeah.
because they just didn't have the weak or the strength. They just had too much weakness and they
Yeah.
were shocked by that. But again, that's a gradual thing that has happened over time that's due to deconditioning, essentially. You know, Obviously, if we ignore that, we're going to have increased injury of risk, especially if we are the weekend warrior type. And then sometimes we'll develop compensatory things, which then down the road can lead to pain also.
Hmm. Well, I guess final question then. Let's say somebody's listening. They work primarily at a desk. They're keyed up off of what you're saying. They want to make changes today. What would you say would be the first best step that you'd
First best step, find a way to get out of that position. Set a timer every 30 minutes, every hour, depending on what you can, and even 60 seconds doing, you know, 15, 20 heel slides, or sorry, heel raises, going up on your tippy toes to increase blood circulation. You're standing, maybe do 10 squats, maybe just do a 30-second stretch. I think that best thing for just making that change is starting to get out of that same position and doing something to stretch and get some muscles active. If you can, make sure you go on a walk during lunch, 15 minutes. Just some movement is good, better than no movement.
Such good advice, Josh. I really appreciate it. Well, if desk work is leaving you stiff, sore, and frustrated, you don't have to wait to begin. You can start now. Earlier you address your mobility restrictions or movement patterns, the easier it's going to be to stay active and healthy long term. You can learn more from Vance Physical Therapy. Schedule a free consultation at vancept.com. And if you haven't already, make sure that you subscribe to the Optimal Health Guide and submit your questions for future episodes at podcast.vancept.com. Again, Josh is looking to help you move toward living and experiencing the optimal health that you long for. Thanks so much for listening today.